Okay, good evening and welcome to ANZCA's Environmental Sustainable Network webinar. This webinar is Time to Gown Up Sustainably, and it's great pleasure for me to be chairing this evening's webinar. I'm Eugenie Kayak. I'm Deputy Chair of ANZCA's ESN and an anaesthetist in Melbourne in public and private practice. I'd like to begin by acknowledging and paying respects to the traditional custodians of country throughout Australia and to the Ngāi at the Tanawa and Whenua of Aotearoa and the special relationship with Pacific peoples. We've got a great lineup of speakers tonight, and before I begin, I must also say that we are recording this webinar, and we ask you to put any questions, and I'm sure there will be lots of interesting questions in the Q&A, and we're trying to very much allow time for questions at the end. So without further ado, I'd like to introduce Associate Professor Forbes McGain, who I'm sure many of you may already know and be aware of his work. He's a national and international leading researcher around healthcare, environmental footprinting and life cycle assessments, and he's been doing this for over 15 years. As well, he's an anaesthetist and intensivist at Western Health and Associate Dean Healthcare Sustainability at the University of Melbourne. And tonight he's going to present to us the environmental impacts of single-use surgical gowns. Thank you, Forbes.
Thank you very much. I think I'm unmuted. Can people see that? I'm just getting it onto the correct, there we go, system. All fingers up, Eugenie, all happy? Good, great. So thanks everyone for being here. Without ado, these are two quotes I heard very recently this year. I know that reusable gowns use more electricity, energy and water than single-use gowns, and I know these paper gowns can be recycled. So just as an example of, I suppose, some perhaps misinformation that we still need to work on in our broader, with our broader craft groups in anaesthesia, surgery, operating room, etc. Listen to in the operating rooms at Western Health. So I would also mention just a small point, nice little study recently. It's not all just about energy and water and things like that, which I think are incredibly important and which I'll talk to you more about. But this is a nice little study we did about comfort, because before that, wearing reusable versus disposable gowns, there was one paper which showed, and there's very little information out there, that the staff within hospitals preferred single-use gowns. And that wasn't something that anecdotally I knew much about, and I thought that's a bit strange, certainly during PPE gowning up during COVID. And so we went and studied that further. So worth a look. What I would say is we're going to look at a little bit at some life cycle studies in the next few minutes. Just a little summary. I know these sort of photos have been out and about before, but essentially if you're going to be looking at what's going on with washing things, what's going on with packaging things, you'll recognize on the right-hand side, and putting in the steam sterilizer. In fact, here, all those wraps you can see there, that's all the reusable gowns and similar cotton, linen and polyester combinations that we use there. So lots of steam sterilizers in Western Health going on this, but not so much in many other places, because all this would be not actually happening in the steam sterilizer, it'd be thrown into the bin. So probably the best study for those who are interested to look back on is now 13 years old, is a nice study of Michael Overcash back in anesthesia and analgesia, state of the art, where he looked at 15, so I'll just come back to that in a moment. Sorry, team, that didn't work. He looked at 5 different studies. There's a nice review of gowns being used in a number of different studies, one of them in Australia. A much more recent study which shows similar results was Joseph John and the team in the United Kingdom, where they were looking at a hospital laundry. Interestingly enough, although, as some of you probably know, there is a lot of energy and influence and important work going on with sustainability in the United Kingdom, but very few reusable gowns have been used. What I wanted to quickly show you here is this is the study by Overcash, looking at the review of 5-6 different papers. You can see RMIT in the centre there, Royal Melbourne Institute of Technology. The important point is that you can just see, I won't give you the numbers so much, but you can just see for all of these studies, the environmental reduction when using a reusable system, in other words, washing and sterilising, etc., is less than the disposable equipment for gowns. And so contemporary, I know this is a wordy text, but I'll just point out a few points so you can focus on here. Competitively priced, comparing reusable and disposable, which is always important, that the benefits of reusables in multiple modes, and it's interesting thinking about water less for reusable, because we always see all the water being used, you can imagine it being like a washing machine, but there's actually a lot of water used in single use in the production, in the petrochemical factory, for example. And so in all of these common life cycle footprints, better for the reusable product. And quite interesting summary here, I thought was quite strongly worded, really. It is no longer valid to indicate that reusables are better in some environmental impacts and disposable than others. It is important, in other words, they're better in all points. It is also important to recognise that large-scale studies of comfort, and I cut it out there, need to be done, large-scale studies. So in summary of those 5 studies, just giving you in a nutshell, if we were to use a reusable gown, this gives you an idea of what it would be in Melbourne using reusable gowns versus a single-use gown generally made in China, although not always. Essentially, by using a reusable gown, you're not burning a litre of petrol. That's about an approximation. So if you don your disposable gown, you're burning a litre of petrol. That's a rough approximation. So you're driving in an average car, much more if you've got an electric car, but you're driving an extra 10 kilometres at work, is one way to think of it. If you're using a disposable gown, you're driving 10 kilometres further for every time you wear that gown. What I show you, this sort of strange looking graph shows you the importance of electricity, and I'm just going to quickly whip through this. This is the national electricity market, showing you the dramatic swings from day to day, with solar energy, with green being wind energy, blue being hydro, lots of black coal feeding into the national electricity grid, and lots of brown coal in Victoria. But you can see, importantly, I just want to show you this because the source of energy is important, and it is changing rapidly. This yellow, which is solar, didn't exist essentially 10 to 15 years ago, and now it's forming around 40% in total for renewables. And so that's really important because it feeds into the story of renewable electricity makes reusable better. And just to show you again, we're heading the right way in Victoria. I know that in Tasmania and the New Zealanders who are listening in, I know you've already got the renewable electricity, but I'm just thinking that it makes reusables better. It's not just the lights, it's about the gowns, it's about everything. What I would show briefly also is our study we did of knee replacements. And just in a nutshell, what I wanted to point out is that we were genuinely surprised that if you consider a general anaesthetic for a knee replacement versus a spinal or a combination of the two, it's this story here of electricity for cleaning reusables, mainly the gowns actually. You need a gown for spinal, you don't need a gown for the general anaesthetic. And so you can see where there's a difference. In Melbourne, nowhere near as much. In Cliff Shelton's UK, it'd be about a third of that. But it's just showing you that difference of important factors flowing into different carbon footprints. And I would say is that moving on as a last little step before I finish up is we've talked about reusable versus disposable, and reusable are better, but also I wanted to say that things are changing also potentially from the point of view of not using a gown at all for spinal anaesthesia, for example. Cliff might talk a bit more about this, but you can see quite a number of US, Canada, Great Britain not using gowns routinely for spinal anaesthesia. And that's very different to ANZCA's requirement. So you can see just briefly there, there's a number of, obviously for central venous catheters, or rest of it, still do it. Make sure you wear a mask, very important. We don't want to get MRSA from our nose to the patient, causing or any other number of nasty getting into the spinal column. But very much less of an issue is the gown itself. Thank you for your time. The reason why I have the Emperor's New Clothes there is perhaps we don't need to be wearing a gown at all when we're doing spinal. Thanks for your time.
Great. Thank you very much, Forbes. And you've given us quite a bit to think about and to assess in our practices. So next we have Dr. Ben Dunne, who is a thoracic surgeon at the Royal Melbourne Hospital and also their clinical sustainability lead. He's co-convener of Doctors for the Environment Australia's Sustainable Healthcare SIG with yours truly, and chair of the University of Melbourne Environmental Sustainability Surgical Network, as well as a member of RAC's Environmental Sustainability and Surgical Practice Working Party. Quite a mouthful, but he's on many committees and been leading change very much over the last few years. And one of the things he's been very involved in is the development of RAC's position statement on reusable surgical gowns. Thank you, Ben.
Thanks so much, Eugenie. I hope everyone can see my slides. And yeah, I'm here to talk about the RAC's position statement on reusable sterile surgical gowns, sort of why we went about it, how we went about it, what effect it's had, if any, and what our plans are next. So Forbes sort of touched on this, but essentially when we started to have conversations in a few different hospitals about, bringing in some reusable sterile surgical gowns or even piloting them, we came up against a number of barriers pretty quickly. The sort of things that we heard were that they weren't safe from an infection prevention perspective. They don't comply with the ACORN standards. ACORN is the Australian College of Perioperative Nurses now. There's no environmental advantage. Staff don't like them. They're too expensive. They're logistically difficult because, you can't just throw them in the bin. And there's, somewhat complicated existing linen contracts and agreements, especially in the public system. And so we decided to bring together the available evidence in this RAC's position statement on reusable sterile surgical gowns in an attempt to address as many of those barriers as we could. We weren't able to address them all, but I'll quickly run through how we went about all that. If you want to scan the QR code and go directly to the statement itself, it's on the college website. You can do that, and then you don't have to listen to my talk at all. We started with an initial literature review. Thankfully, we were very happy to find that there was plenty of, two pretty high-level summaries out there, meta-analyses showing that actually the WHO and the Centre for Disease Control say that reusable surgical gowns are just as effective as single-use surgical gowns for the perspective of preventing surgical site infections. So that was an easy start. And as Forbes mentioned, there's also pretty solid evidence out there. This is a slightly newer version, essentially just recapping the evidence brought together by Michael Overcash a few years ago, showing that from the point of view of energy use, global warming potential, water use, and solid waste generation, reusable gowns were dramatically better than single-use gowns. This is a bit of a busy slide, but essentially it is to say that there are a number of ACORN and Australia or New Zealand standards that any company that wants to provide reusable sterile gowns needs to comply with. That's all of them listed there. There's 5. But essentially, from a clinician or hospital's perspective, all you need to do is ensure that the provider of those gowns can produce evidence that they've met each of those standards by accreditation through one of the independent assessors. So it's not on you to prove all these things. They should just be able to provide evidence of the accreditation. On top of that, a survey we ran of the College of Surgeons, all fellows and trainees back in 2002, showed that actually 70 to 80% of surgeons surveyed were happy to change to reusable gowns if the opportunity was provided to them. And there had been one old paper followed by Forbes' better paper showing that staff actually did find reusable gowns often a lot more comfortable than the single-use gowns. So that was a number of barriers ticked off pretty quickly. So how did we go about getting this brought together? We thought that one of the most important things was that it couldn't just be the surgeons coming out and saying this. The most important people to bring on board early on were the Australian College of Perioperative Nurses, as well as the Australasian College for Infection Prevention and Control. So we reached out to them very early on to let them know this is something that we were interested in writing a position statement on, reviewing the literature, and then writing it in conjunction with them. And they were open to that idea. The initial position statement was drafted by Caroline McCallum, who's a breast surgeon at Royal Melbourne, and we owe her quite a lot for the work she put into this. We then reviewed it at our RAC's Environmental Sustainability and Surgical Practice Working Party. Sorry for the awful title. And once we were happy with it internally, sent it to ACORN and the ACIPC for input. They then reviewed a few bits and pieces, had some suggestions around, ensuring that monitoring was in place if a change was made, which is very reasonable. And then all three organizations were happy to endorse it. And that was when we released it publicly at that point. We've gone on then and obtained some broader endorsement from other colleges. The two other main procedural or surgical colleges, the College of Ophthalmologists and the College of Obstetricians and Gynecologists, have both endorsed it, as well as Doctors for the Environment Australia. It's been progressing through the systems at ANZCA as well as KICM and ASIM, as we wanted to bring those other large kind of procedural-based colleges on board as well. And we're planning to sort of make a bit of an announcement and start to circulate it out more broadly to the different surgical specialty societies after our college ASM in May of this year. And at that point, we'll have some more media. There was already an initial media release, but that'll be followed up with a sort of a letter to the editor or a journal piece, which will be published in one of our surgical journals to make sure that the broader surgical fellowship is aware of it. Have we achieved anything with this? Well, I think it did open the door for some pilots of reusable gowns, particularly at Peter MacCallum Hospital. This is a picture of Hayden Snow trialing some reusable gowns and drapes in Peter MacCallum Hospital. It's certainly helped make it a little bit easier for me to have conversations about reusable gowns at Royal Melbourne Hospital, even though we're not quite there yet with our pilot. Stanley Chen, who's a surgeon up in Hunter, New England, and the New South Wales Net Zero Surgical lead, has also led another pilot of reusable gowns in Belmont Hospital near Newcastle. And I think having this information in writing and endorsed by the peak bodies just helps reduce some of the barriers encountered. It got featured in the National Health and Climate Strategy, as well as a photo of Hayden in his reusable gown. And it's facilitating some discussions about theatre-only linen contracts for reusable linen in our Parkville precinct, Royal Melbourne and Peter MacCallum, as well as, hopefully we'll make some discussions with Health Share Victoria about reusables as a core component of state linen contract, a bit more important. We haven't solved all the problems. From a cost perspective, certainly in Victoria, they remain slightly higher than the cost of single-use gowns, but not in a significant way, really. There's always going to be more logistical hurdles. When there's reusable gowns, you can't just throw them in the bin. They do need to be segregated, collected, cleaned, brought back and stored. So there's some logistics to work through at any site. Currently, availability remains a little bit of an issue. There's two companies, Linen Services Australia and Retex Australia, but they're both working to improve their availability in terms of what they can provide and how many sites they can provide reusable gowns and drapes to, as well as some existing statewide linen contracts. Certainly in Victoria, the linen contracts for hospitals are all run centrally through Health Share Victoria, and that's mildly complicates things, but hopefully not for too long. We do have plans for some other similar work because of the success of this position statement. Again, bringing together the evidence around reusable versus disposable theatre caps. I really don't like seeing the disposable theatre caps worn around all the time, and I really don't think they're necessary. Same thing with the disposable shoe covers we see a lot of. Also looking at a position statement on using the alcohol gel instead of the traditional surgical scrub. That saves an awful lot of water. Using the alcohol gel is just as effective, better for staff skin conditions, and also prevents all the different chemicals ending up in wastewater, as well as looking at mechanical VTE prophylaxis in theatre. So there's a few more pieces of work in train at the moment along the similar lines based on the success we've had with this position statement. That's about it. Thank you very much. I hope I kept to time, and thanks for having me.
No, thank you very much, Ben. And yes, you did keep to time, and really congratulations on that position statement. And I was just thinking, I wonder if we should be placing bets on how long it takes for actual practice across the board changes, and be really interesting to study and explore what some of those barriers might be. Next we have, just a reminder, please put your questions in Q&A because we have allowed a considerable time at the end for those. Next, we're really fortunate to have Dr. Marion Kainer, who is an infectious disease physician and healthcare epidemiologist trained as an epidemic intelligence service officer or a disease detective at the US CDC, or Center for Disease Control, in their hospital infectious program. For her work in America, she was named Tennessean of the Year and also honored by the Obama White House as a champion of change for her prevention and public health in 2013. We are fortunate to have her return to Melbourne in 2019, and since then she's been head of infectious diseases at Western Health and had a leadership role in preparing for and responding to COVID-19. And Marion tonight is going to present and inform us a little bit about the infectious control perspectives related to reusable surgical gowns. Thank you, Marion.
Great. Thank you. And okay. So gowns, whether disposable or reusable, are single-time use items. So what everybody in infection control in infectious diseases was really worried about is on the wards that people would just hang up the reusable cloth gown. And that's a big, big no-no. So as long as that reusable gown gets disposed of after that single use and does not get reused for that patient in the future, that was probably our biggest concern from an infectious diseases infection control perspective. They are so much more comfortable. The cuffs are so much more comfortable. They've got some heft to it. They're not flimsy. And from an infection prevention perspective, they are far, far easier to remove without contaminating oneself. So they are actually better than single-use gowns, really quite dramatically so. Now, what's the gown purpose? Let's just go through some really basic stuff. Well, they are to protect healthcare personnel from contact with blood and body fluids, organisms in the environment or on the equipment, organisms from infected or colonized patients. And it's also to protect patients from organisms that could be passed from healthcare personnel during invasive procedures such as central line insertion or surgical procedures. Now, there are barrier level protections for isolation gowns, and that is how much strike through you have. There's level 1, which is the lowest, and level 4 is when you expect to have high risk of blood or body fluid exposure. So if you had cardiothoracic surgery or orthopedic surgery, that would be a level 4. Level 1 would be just a very basic one. And there's specific standards on how this is actually measured. And you can find the details here. Now, interestingly enough, gowns are actually classified as a medical device by TGA. And this was guidance which came out during COVID, where it's not only the gowns, but also aprons and face masks and gloves are actually classified as a medical device. So they need to be included in the ARTG before they can be supplied. Now, since these are reusable gowns, there are some standards that need to be adhered to. This is the Code of Practice for Public Healthcare Operated Laundries and Linen Services. And this is the standard for laundry practice. This was published in 2000 and it's pending revision. So here are some fine points in the implementation. So just like general clean linen, it must be delivered to clinical areas daily on a clean covered trolley. The linen trolleys must be covered at all times. Clean linen must be stored in a clean, dry place that prevents contamination by aerosols, dust, moisture, or vermin. And where linen is stored on the trolley must be fitted with a washable cover that can be fastened at the front or placed on a cleaning schedule. If it's in a cupboard, the cupboard door should be closed at all times. There needs to be periodic cleaning of the shelves. The linen should be managed with first in and first out basis, and you need to make sure you don't contaminate the linen itself. So alcohol-based hand rub is important. You need to disinfect the hands beforehand, minimally handle. You don't put dirty linen together with clean linen. So this sounds all really, really basic, and you're probably wondering why I'm telling you all this. Well, this is actually really important, because when you don't adhere to this, you can have really, really bad outcomes. So this is a paper which was published, I believe, last year, on the investigation of a really large, horrendous outbreak of healthcare-associated mucor cases in a hospital in Arkansas. And this outbreak ran from 2019 through May of 2021. They had a marked increase in hospital-wide healthcare-associated mucor, and that was defined as getting mucor 7 days or more after admission. And they had no cases in 2018, 3 in 2019, and 6 in 2020. This is per 100,000 occupied bed days, is the equivalent to patient days in the US. They had 16 healthcare-associated mucor cases, and about half of them had a hematological malignancy, but the rest were in the ICUs. And many of them had recent traumatic injury, and they had terrible outcomes. 38% died in hospital, 25% were transferred to hospice, and there wasn't anything else that was epidemiologically linked. They were in all different wards, different procedures, different products. So it was a general common exposure, which was really the problem. And that what they observed was suboptimal handling of laundered linens and inadequate environmental controls at both the hospital as well as the contracted offsite linen provider. And they sampled 98 linens, and 9 of them, when they came into the hospital, were contaminated. Now, of note, that laundry was accredited by industry standards, and they said it was a laundry that was fine. Of note, in the US, those standards don't fully align with the current CDC standards. And so issues which that particular laundry had is they didn't have a functioning air conditioning system. So they opened the windows and the doors for personnel to feel more comfortable inside it. And they didn't adequately separate the dirty linen from the clean linen. So major issues. Yeah. So a few do's: you have to wash or clean your hands before donning any PPE. It's important to, again, perform hand hygiene after removing the PPE. It's important to make sure that the gown is properly worn and it covers completely the clothing. And you remove the gown by slowly rolling it away from the body, and so you keep the contaminated sleeves inside the bundle. Want people to remove the contaminated gowns inside the patient room or in the anteroom, not in the corridor. And it's for, as Ben had mentioned, it's important for logistics reasons to go and put it in the appropriate basket for so it can go to the laundry. The things which are really important is don't reuse the gown for the same or different patient. Really, really important. This is the thing that is going to get infection preventionists and infectious diseases physicians really concerned. You don't push or roll the gown sleeves up your forearm, and you don't wear a non-sterile gown when performing invasive procedure or surgery. A sterile gown must be used there. This is from the Association for Professionals in Infection Control. Now, one issue which we have found at Western Health is that the reusable gowns which we're using, the material is quite slippery, and so gowns can actually fall off the trolley and hit the floor. And so one way that we are trying to overcome this is by these PPE soldiers. It's an easy way of holding the gowns so that they don't slip off. So some take-home points. These reusable gowns are so much more comfortable. They're far easier to remove without contaminating oneself. They're single-time use only. You don't ever hang them up for future use, even for the same patient. They're regulated as a medical device, and adherence to linen standards is important at the laundry and at the healthcare facility. Thank you.
Wonderful. Thank you very much, Marion. And we look forward to further questions on that at the end as well. So next we have Dr. Cliff Shelton, who's joining us today from the UK, early morning for him. He's a consultant anaesthetist at the Wethershave Hospital in Manchester and senior clinical lecturer in anaesthesia at the Lancaster Medical School, where he's a director of simulation and clinical skills for the medical degree. He also has research interests in quality and safety, sustainable healthcare, and education. He's executive director of the journal Anaesthesia Reports and vice chairperson of the National Institute for Academic Anaesthesia Health Service Research Centre. He's joining us, as I said, from the UK and is going to talk about whether it's time to reevaluate the routine use of sterile gowns in neuroaxial anaesthesia, as Forbes alluded to earlier. Thank you very much, Cliff.
Thanks ever so much. Can I just check you can hear me okay?
Yep.
Great. And I'm just going to make a tiny correction, which is I'm the vice chairperson of the Patient and Public Involvement Group of that august organisation that was just mentioned. Otherwise, somebody's going to think I'm after their job. But thanks ever so much for the introduction and the opportunity to speak about this topic, which is whether it's time to reevaluate the routine use of sterile gowns in neuroaxial anaesthesia. So I'm an anaesthetist. I do lots of obstetrics. I do lots of orthopaedic trauma. Basically, I do a lot of spinals and I do quite a few epidurals as well. And this is a topic which comes up fairly regularly when I talk to sustainability interested colleagues, but particularly when I talk to colleagues who are international, because there's lots of variation in practice in this respect and very little evidence. So I'm going to tell you a little bit about the UK perspective first, and then talk about the international perspective, and then make a pitch to you about re-evaluation. So in the UK, I would say we're a bit nervous, or maybe very interested, very careful about what goes on with spinal anaesthesia. And there's two cases that I think kind of inform our cultural approach to this. The one on the left is very famous. It's called the Woolley and Rowe case. And this is, you know, half a century old now, but was a case of two people who became paraplegic having had some spinal anaesthesia, which was thought in the end to be down to a chemical contamination of the needles and the equipment that would be used, but certainly set back the agenda of regional anaesthesia in the UK for a long time. And then when I was training as a doctor, there was a very famous case that you can see on the right of the anti-cancer agent vincristine being injected intrathecally. Again, I think made everybody just pause for a moment to think about their practices. So whenever I think about changing people's practices when it comes to spinals, I've always got this kind of baggage ringing in my ears of things that might be making us slightly worried. But gowns really aren't about that. They're about infection. But I think it all plays into the same psychology. So what informs all of this? Well, I think we're a bit worried about intrathecal injections in general. We've got a sort of inertia that we've always used gowns, masks, gloves and drapes. And lots of the things that we have to guide our practice, for example, the documentation with the tick boxes on it that I use at work to say what I've done when I've put a spinal in, tends to incorporate all of these infection control measures and applies a little bit of pressure to make me stop and think, well, maybe I should be using a gown. Am I the odd one for not always doing so? But maybe times are changing, and I'll explain a little bit about why. So this is a paper which I think is the reason why I was asked to come and speak here. As you can see, I'm an obscure second author, but Bradley Toohey, who's, I believe, a fellow in Melbourne, and Forbes, who's already spoken, as well as Stefan Dillerman, were all co-authors as well. And we were interrogating this question of, well, what's going on internationally when it comes to gowns and neuroaxial blocks in terms of guidance and in terms of evidence. And if you've not seen this letter, you can point your phone at that QR code and you can have something to read later on. But I guess the overall idea we were working with is how come it's okay for the Americans, for example, not to wear gowns? Why do the Australians make it mandatory? And what's going on in the UK and Europe? And I'm going to show you two little bits of information from that paper. And this is the one that I think is most informative. This is a table of the guidance on the practice of neuroaxial anaesthesia with regards to infection control from as many different bodies as we could find. And at the top of the list is ANZCA, who are very pro gowns, as has already been described. Then we've got the American Society of Anaesthesiologists, ASRA, and they're sort of on the fence a bit. You can see down there at the bottom of the third column, it says the consultants and ASA members were equivocal regarding the wearing of gowns. The Canadians take the view that they should do what the Americans do. And in Great Britain and Ireland, we've actually had 2 iterations of our guidance. And I think this is kind of interesting because it's changed over time. The most recent one just says that for central neuraxial blockade, an aseptic technique should be used and doesn't say any more about it. But it does say specifically that maximum barrier precautions, including a sterile gown, should be used, for example, for central venous access. And when you compare that to the guidance that was issued in 2008, well, that was very pro-gowns. So we're clearly changing our minds in the UK, but maybe not feeling brave enough to say as such explicitly. The European Society, the Brazilian Society, and the WFSA all give a bit more detail about the technique, none of which involves the routine use of gowns. So this is an interesting international situation that we've got lots of different developed, well-funded healthcare systems that are all saying something slightly different. So when we turn to the evidence, what do we find? Well, when we combed through all of these guidelines, we actually found a single randomized control study that looked at this, and it was this one here by Siddiqui, which was cited by the American organizations for a reason to justify why they don't necessarily recommend gowns. And it was a couple of hundred patients who had epidurals, and everything was the same apart from the use of gowns, and there was no significant difference in colonization as opposed to infection rates when they took the epidural catheters out and looked at them. So this is kind of it in terms of, experimental evidence. We do have some surveillance evidence from the UK. This is a study called NAP3. It's quite old now, 2009, but it was a year-long study that looked at major complications following neuraxial access. And you can see here that they found 17 cases of epidural abscess and 3 cases of meningitis that they thought might be associated with a year's worth of practice. And in a year, they estimate that over 700,000 blocks are done. What I think is interesting about this is they really didn't have enough cases of meningitis to give any advice about what could be done to prevent it or who was more vulnerable to it. But when they looked at abscess, they found that almost all of those cases had something that could have alerted the clinician to maybe take some extra precautions. So, for example, 12 of them had compromised immunity that was known at the time of the procedure. So why do I think that the guidance has changed a little in the UK? Well, I think it's possibly those things that I've just described, but also there's a few other bits and bobs that have been going on in the background. Perhaps most significant is this concept of the rapid sequence spinal. I don't know how this translates internationally, but as an obstetric anaesthetist, this is what we do if we're in a hurry to get a cesarean section done in a patient for whom we think a spinal would be beneficial or a GA would be perhaps dangerous. And you could argue that that's most patients who need a cesarean. And you can see in the box here that they advocate specifically for a gloves-only technique, a no-touch gloves-only technique with a face mask but without a gown, with the justification that this saved time. And we started doing a lot more spinals and obstetrics for COVID, and I have to wonder if we did a few more of these sort of rapid sequence approaches. Then there's the things about environmental awareness, the fact that our colleagues over in the USA do not routinely gown, and yet their outcomes seem no worse than ours, and also what our physician colleagues are doing. So there isn't a source of national guidance I can find about what the guidelines should be for example, for diagnostic lumbar puncture. But when I look at local guidelines or even guidelines promoted by, for example, the Royal College of Physicians, we find that sterile gloves without the gown is the norm. And then there's the change in the association guidance, and then potentially there's the money as well. So what am I doing? Well, I've taken literally the advice of my association, and I'm doing what it describes. I'm using an aseptic technique without a gown routinely. If I'm worried about the patient, I'll use a gown. And some of my colleagues feel the same way. I do, as Forbes has noted, always wear a mask. There is evidence to suggest that that's important. Clean my hands properly and I wear sterile gloves. And another practical tip is that if you, like me, have all these ID badges and things dangling off you, make sure you tuck them away and take the pens out of your pockets, because nobody wants their pen falling onto their sterile field midway through a procedure. But I do think we need proper national guidance on this, or at least regional guidance. And I've put this forward to our institution so that we actually have, for the first time, an institutional guideline, but that's a work in progress. So is it time to reevaluate the routine use of sterile gowns and neuraxial anaesthesia? I would say it very much is. It will save us some carbon, it will save us some money, and hopefully it will make no difference at all to the patients, certainly on the basis of the evidence that we have at the time being. So I say, go for it. Thank you very much.
Wonderful. Thank you very much, Cliff. And to everyone, we've now allocated 20 minutes for questions, and we would really appreciate if you did put some questions into the Q&A. I think you can, I would like to thank all the speakers. They were 4 very interesting and true-time presentations, and I would think given us all a lot to think about. There are some questions in there in the Q&A, but maybe I'll just start because we've got 2 people here from Western Health. And Western Health seems to have been a leader in the area over the years when it comes to reusable gowns. And could you just maybe reflect on what you think some of those enablers were? I'm sure a lot of that was your leadership, and in what procedures you actually use reusable gowns at Western Health. Did you want to start, Forbes?
Okay, but I'll let Marion chime in as we go along. Thanks. So I think probably, so we'd already had, what made it easier was that we already had reusable gowns as standard for most surgical craft groups, apart from orthopedic surgery. There has been, so there's been a long sort of history of reusable surgical gowns. And then during COVID-19, I mean, I was working, I work in intensive care, and we looked it up that in 2020, there were 1 million disposable PPE gowns used. And I said, well, this is rather crazy. And we went to Marion and we just said, what can we do here? And so we got with infection prevention and environmental services. We got the linen contractor, the ICU nursing staff, and we did a pilot in the ICU to just swap out the disposable and swap in the reusable. And then I remember one particular day, there was a radiographer trundling along in the morning and doing their X-ray round for the morning. And they said, what are they? And I said, well, they're the reusable ones. They said, well, we want them. And so that was great because so in other words, it had nothing to do with me. It was just rolling on. And so this rolling story of having reusable gowns. So I think a pilot was really important. A pilot with champions and support from infection prevention, just bringing all the team in together to do that. And I think also it's just that I think there's somewhat a bit of a philosophy of just I suppose subtle innovation and change and allowing people to do things that are a bit outside the box. So that's my viewpoint. Thanks.
Thank you, Marion. Did you want to add something to that?
The single-use gowns were terrible. They were absolutely terrible. If you wanted to remove them, it was really, really hard to not contaminate oneself. And then the supply chains were a real issue. So we looked at the state supply, and we looked as if we were going to run out within a few weeks. So we actually tried really hard to implement reusable gowns, but the linen supplier didn't have enough. So we tried all linen suppliers at the time. It didn't have enough available. And then we actually had some volunteers sew some gowns for us, which we could use up to 20 times to have as a backup in case our single-use gowns supply ran out. We even explored potentially re-sterilizing the single-use gowns because we were so concerned about the supply chain. But that didn't work well. So the cloth reusable gown is just a pleasure to actually wear. And it's just so much more comfortable, and you can take it off without contaminating oneself. And when you've got a patient in contact precautions, wearing a gown does nothing if you can't take it off without contaminating oneself. And if anyone wants to go and examine if they can take it off without contaminating yourself, get some chocolate sauce, put it on the gown, take it off and see if you've got chocolate sauce on yourself. And you can see how difficult it is to actually remove a disposable single-use gown without contaminating yourself there. So thanks.
Oh, okay. No, thank you very much. And interesting, isn't it, that, well, we know that, but COVID did many things, and it sounds like it was very much an enabler for your change of practice at Western Health for PPE. And it also seems that in the Western Health theatres, you use reusable gowns for all your procedures apart from orthopaedics. And it might be just an opportune time, because I'm sure lots of people here are members of ANZCA, to say that ANZCA has actually officially just recently agreed to endorse the RAC's position statement on reusable sterile gowns. So maybe we can all reflect on how we might be able to influence change in our workplaces. Before I ask another question, Forbes has got his hand up, so please, Forbes.
No, it's a quick one. Just to add on to Marion's. Have a look for those interested. Gowns for doctors, Kirby White, based in Medico GP. We went out and visited her. Sam Bates, ICU nurse extraordinaire, assisted in the process, and I think that was really important as well, learning what the GPs were doing. They ran out completely of disposable gowns, and as Marion was saying, they had to basically get seamstresses to make their own, and that was a wonderful sort of story about gowns for doctors. She got a Victorian of the Year for that, so thanks.
Now, there is another question, and I think this is probably leads to it. I mean, you have all presented a lot of great evidence tonight, and a bit of, I'm sure everyone else, I'm saying, well, you know, why are we doing what we're doing? But one of the questions is there a change management guideline available that provides instructions for on-site hospital laundry and infection control teams? So a how-to-do guide, I guess, to create that change at your workplace. And Ben, would you like to comment on that or something else?
Yeah, I don't think there's a how-to-do guide on how to transition over. I think some lessons could be learned from what Western Health and other places already do. But I think it is to a degree spelt out in the standards that are required to be met. The ACORN standards or the ANZ New Zealand standards. They're all listed in the RAC's position paper. You can see the 5 of them that you need to meet. Marion touched on all of them through her talk. Thank you very much, Marion. So it is there in terms of what needs to be done. How it is done, I'm not aware of any guide, but maybe Cliff has something up his sleeve.
Okay, thank you, Cliff.
So, sadly, nothing specific up the sleeve, but one comment I would make, reflecting on the experience that we've had in a lot of the hospitals where I work, is that there has been a tendency to close down many of the on-site laundry and reprocessing facilities as single-use equipment has come in. So one thing I would, one of the regrets I think we're now having as a system is letting those things go without a great deal of opposition. And a really good start for this is if you've got stuff like that where you can reprocess on-site or clean on-site, sterilize on-site, make sure you link up with the people who are running it and make sure that they know it's got a future. Because if you lose something like that, really, really hard to put it back again.
Yeah, no, thank you, Cliff. That's true here as well, and probably particularly relevant in Victoria, where our public hospitals, as Forbes mentioned, and they have undertaken that by 2025, which is next year, for their electricity to be supplied by 100% renewable energy. So that carbon balance really does support reusable gowns. But then if you don't have the appropriate sterilising processes, that makes it impossible. We'll go to Ben, but then I'll probably go back to you, Cliff, and ask you whether there's been any pushback with your own practices with your neuroaxial blocks and not putting a gown on in your workplace. But Ben, you've got your hand up first.
Yeah, I just wanted to say the 2 companies that currently provide these gowns in Australia, like take them off-site, launder, re-sterilize them off-site, and then redeliver them to the hospitals. So it sort of works around the requirement to do the on-site sterilizations. That I should have mentioned that earlier on. That is an option to explore. That was all I thought I'd add in there.
No, well, that's a very good point, isn't it? So for the gowns, and on-site sterilisation capacity is not necessarily needed or is not needed. Cliff, did you want to? How have you gone? You said that you're now doing spinal procedures without using a gown.
Yeah, and actually, when I spoke with my colleagues informally about this, there's a fair few of our colleagues who haven't for some time. I'm in no way a pioneer, but I think one of the things that thinking about this together with Forbes and Bradley and Stefan and looking at the evidence, that sort of made me change my behaviour. But I probably wouldn't have changed my behaviour if I didn't also know that my national guidance would support me in doing so. So it's important that the Association of Anaesthetists say that you have to use an aseptic technique for a neuraxial procedure, and then somewhere else mentions that if you've got an immunosuppressed patient, you will want to use maximum barrier precautions. So I'm not breaking any rules, and our institution doesn't have a guideline specific to spinal anaesthetics that compels me to do otherwise. I think it might be a bit harder for those of you who are working within the ANZCA sort of umbrella, because you've got a guideline that tells you what to do. So I guess you might have a bit of a job to critically consider whether that's still appropriate in the international context. And I think some stuff that's very reassuring is that, certainly in the USA, very highly funded healthcare system with good outcomes, they just don't do this and have never done this by and large, and don't have a load of patients suffering from meningitis and epidural abscesses as a consequence. It's also a very high surveillance and high litigation healthcare system in the USA, and so I find that very reassuring. So no, I've experienced no pushback on a personal level, though I've never come onto a webinar and talked about it, so you never know, I might have an angry email in my inbox later on today. We'll find out soon.
No, thank you. And it does sort of highlight, I mean, we do work in a regulatory environment, don't we? So having the appropriate guidelines to enable practice change is important. Marion, please.
Just a clarification, with these off-site laundries such as Linen Services Australia, they do the laundering, the sterilisation. Most hospitals will be able to sterilise things on site with autoclaves. It's the laundry, the actual washing and the drying, which is done off-site, and that is many of our hospitals have outsourced that. Okay. So just as a clarification there.
That's really important. And probably just going on from that, then Marion and Forbes and others, when you have the actual sterile gowns that you use, maybe not for PPE, but in theatre for sterile procedures, how do you actually store those gowns before they're used?
Just in exactly the same way, so as the disposable gowns. So you probably saw on that picture initially of mine of the blue polypropylene wrap that was containing the reusable gown and huck towel, and that would be stored in a similar fashion to the disposable gowns, because the orthopods and some other craft groups still use that disposable version. I must say, one small point is that it's a constant vigilance. It's a discussion about where we're going to this. As I said, I was trying to say that there are still many craft groups who don't believe that reusable gowns are better environmentally, and that's the first thing. I mean, as Marion said, there's also the comfort and other things as well. But yeah, it's fascinating.
Okay, no, thanks. Now there's a question. Maybe it's for you, Ben. It said it was your next step, but someone has put in that some of their theatre nurses are saying that even reusable theatre caps are not meeting standards. Is there any truth in that?
So, like in terms of the standards of how they function as a barrier, the single-use ones do not function as a barrier. Most of them don't even meet the level 1 standard that's required as a disposable kind of item. So I'm not really convinced by any argument around them being less effective. We're writing up another one of these literature reviews around that reusable hats are certainly no worse from an infection prevention perspective than disposable ones. The standard that may be being referred to is one that talks about the requirements of an organization to make sure that any linen worn in an organization is like laundered regularly. So then it's about who is responsible for ensuring that the hat you wear in theatre is washed from time to time. So the guidelines say, I think it's every 7 to 10 days or if soiled. So I think what they may be referring to, and a technicality there, is that if you can't prove that your staff are washing your reusable hats regularly enough, then, you know, you could hold that up as a breach of standards. But I think, having not kind of gone through all this in enormous detail, I think that may be the only potential kind of area where it's not meeting a standard. But again, that's not like the most evidence-based standard. I don't think anybody's ever looked at rates of SSI depending on how regularly a hat is washed. You know, the hats usually don't get too close. They're not sterile in the first place, and they don't tend to get too close to the operative field.
Okay, no, thank you. Another question that's been posted, talking about real estate in hospitals, and that it's, you know, space is valuable. With the increase in reusable items, including linen, is anyone that's had successful implementation had to also manage gaining extra additional real estate for linen storage? Forbes, I guess Western, or
yeah, so is the question actually, do you need more? So you don't need more. I mean, physically they're the same size. I'm not sure why
I
you would
think
need
that was
more.
the question, probably. Do you actually need more space? And maybe that's you're answering it.
No,
that's how I interpret the
yeah.
question too.
I mean, given that I see both sort of, so I'm not sure who asked the question, but yeah, I see both in the same sort of area, and I can't quite see why. But anyway, I mean, certainly you need a stock, so you need a stock for that, and generally a rough. Remember the Linen Services Australia, or I think other companies sort of saying you need probably at least 5 times as many as you're actually using per week, or whatever it is, you know, be around. But that's the same sort of story regardless of what gown you use. I mean, you know, that makes sense. It's a 1-for-1 exchange.
Yep. No, well, that's good to note. Marion.
They're just a tiny little bit thicker. So the number may be the same, but they may be just a little bit thicker with regards to that. So yeah.
No, thanks. Ben?
Yeah, but the companies are usually happy to do daily drops and pickups, you know, so on quite a high turnover. So maybe in the usual spot where you might store, you know, 80 single-use gowns, you might store 60 reusable gowns, but they're turned over every day. So that I think is the final barrier we're encountering at Royal Melbourne Hospital at the moment. And my personal feeling is that, you know, if you're down to the argument where there's not enough room in the cupboard, I think you're nearly there. There's ways around that problem in every place.
Yeah, Marion?
The one thing which does take up a little bit of additional space is making sure that you have the linen skip in addition to your, it's in order to put the reusable gown in. So that takes up some space inside the patient room versus you didn't have that one there. So if you've got valuable real estate, it does occupy some floor space where you're getting rid of the reusable gown.
Thank you. We might go with just one last question. Ben, you've got your hand up. Maybe I'll just read this question out. You might be able to answer this one as well. But someone is asking the question, okay, tonight's about gowns, but then do we move on to our draping, full sterile draping? Lots of places are only using single-use drapes. Is there a place for reusable drapes, and what types of surgery? Ben, you're the surgeon, so maybe you might like to answer that as well as with what your hand is up for.
Yeah, so certainly the pilot at Peter MacCallum Hospital, the planned one at Royal Melbourne, and I'm probably Stan Chen, I think also his pilot up in Hunch, New England, I saw he's online actually, did include drapes as well. So I think there's also a question that's popped up once or twice from Janice asking about the strike through. And I think in some of the old cotton-based reusable gowns and drapes, there was strike through and more kind of fluid seeped through both the gowns and the drapes. But the current versions are all polypropylene based, and they're actually much more resistant to fluid than the old ones. The drapes come with a little sort of absorbent strip along the area where you stick them to the patient, so they're actually more absorbent as well than the disposable gowns. they've been very well designed by the companies to, there's been feedback from surgeons along the way about problems that have been encountered with the old versions, and they've, I think, been well addressed.
Right, thank you. Now, Ben, you had your hand up. We're about to wrap up. Did you have something else you wanted to comment on?
Oh, geez, no, I've forgotten.
Oh,
Sorry.
that's okay. Really, thank you very much to all our speakers. It's been very informative. I'm about to hand over to Archie, who's also got some important things to briefly tell you about. But as I said, ANZCA has endorsed the RAC's position statement on sterile reusable gowns, and also another big enabler, which you may or may not be aware of, but in December last year, the federal government released its National Strategy on Climate Change and Health, which does very much have at its heart a sustainable net zero healthcare system. So there are quite a lot of things happening in this space. So Archie's going to say a few words, but before, I'd like to really thank both Archie and Gabby White from ANZCA for organising this seminar, and those who have registered, a link to it will be forwarded in due course. Thank you, Archie. Thank you, everyone.
Thanks so much, Eugenie. And I'd like to thank also Gabby and all of our speakers this evening for making the time to educate us and stimulate some discussion on this really important topic. And of course, I'd like to thank everyone who's taken the time to dial in and participate as well today. Just a couple of things before we wrap up. Gabby, would you be able to share the slide for us, please? Thank you so much. That's fantastic. Thank you. We're currently collaborating with anaesthetists conducting some research in Singapore, so Dr. Peiki Ko. If you have any interest in this particular area, so particularly around gowning for spinals, we'd really appreciate your input to create a consensus opinion across the Royal College of Anaesthetists and the ANZCA Environmental Sustainability Network and anaesthetic fellows across Australia and New Zealand. So this survey on the screen that you can access using the QR code or the link that's provided there takes about 3 minutes to complete. We'll close around 30th of June, although that can be extended. And yeah, we'd just really appreciate any input or feedback that you might have regarding this topic. And finally, for everyone who's dialed in today, I think I counted 85 people at one point, which is fantastic. We'd really love for you to consider joining the Environmental Sustainability Network using the link on the screen. So the network is free to join and it's open to everyone, not just anaesthetists, and allows us to use the platform to link and collaborate with others who are enthusiastic and have interests in advancing the sustainability, improving the sustainability, mitigating some of the effects of what we do in healthcare on the environment. Once you do join, you'll be receiving a link to the Teams platform where you'll be able to join and contribute to some of the discussions that we're having around topics such as sterile and reusable gowns, as well as things like nitrous oxide and desflurane. Finally, we've got a couple of ESM events coming up at the ANZCA ASM for anyone who's coming along. We'll have a bit of an informal meeting on Tuesday the 7th, so it'll be fantastic to see you there, 10:30 in the morning, and the details will be in the program as well. Thanks so much, everyone, for joining today, and to the speakers and Gabby and Eugenie. And we hope to see you at our next event. Good night.
Right. Thanks, Archie. Thanks, everyone. Have a good night.